If you're in ketosis, you're using ketones as your primary fuel source, but you're going to improve your triglyceride to HDL ratio, which is a better predictor of heart disease than your cholesterol or LDL. And if you're concerned about your LDL, you can get the particle sizes, and you'll notice in most cases you're going to increase the large and decrease the small. In other words, the quality of your cholesterol will be better. And of course, when it comes to your appetite, people who eat these dietary patterns are not really hungry. So that's a huge benefit. And me and my colleagues realize that if we can get that hunger out of there, we're going to do much better. So when people are in front of us and we're trying to decide who needs to think about this dietary pattern, it ends up being most Americans, because only about 7% of us are metabolically healthy. So anybody with metabolic issues, their blood pressure, blood sugar, their triglycerides, HDL, or their belly size is not where you want it to be. Those are the people we think about. And we think about who they are. We get baseline information. We come up with a plan. And we even look at their medicines, because as an obesity doctor, I know certain medicines can actually cause you to gain weight, antihistamines, beta blockers, et cetera. And so once we get that in front of us, we start thinking about what's the current state. And as you could imagine, the dietary guidelines, if you look at that image of that pyramid to the left, you'll notice there's a lot of grains and breads and cereal, and that's the foundation of the diet recommendation back then. And even the food plate a little bit later, where you have fruit. I'm not sure a diabetic should be eating fruit and a lot of grain. So half of that plate, it should really be protein and vegetables as the primary source of nutrition. The typical American eats between 225 to 325 carbs a day. And it sounds impossible that that's true, but that's what the data has shown us. So this is what we are going to try to suggest you think about. Again, if you look at a clinic like mine and Dr. Eric Westman, we're really trying to get people under 30 or 20 carbs a day. That's going to allow the average person to have a good chance to be in a ketogenic state. And then you have some who will allow people to be between 30 and 50. It depends on the individual. And then, of course, low carb kind of starts at 130, which sounds like a high number or less. But the reality is, when you compare it to the standard American diet, it's not really a high number at all. It's all about where people start.